Hello, in this video, I'm going to be talking about the connection between hair dye and breast cancer. Before I do, I'd love to invite you to subscribe to our channel. We put content out about 3 times a week, so there's always something new to watch. So what is hair dye, and is there a link between hair dye and the development of or recurrence of breast cancer? Hair dye is made of chemicals. There are additives and fragrances and conditioners, but the chemicals that help the dye permeate the hair cuticle contains oxidizers and alkylators, and these form a bond with the hair to help the hair change color. Lots of studies have been done to investigate whether or not there's a relationship between hair dye and the development of breast cancer. In fact, this question came from one of our viewers asking if we could address the connection. The studies that have been done, including a meta-analysis of 14 studies, demonstrate no relationship between exposure to hair dye and the development of breast cancer. In fact, most exposures that increase the risk of breast cancer happen when the breast tissue is developing or changing rapidly. So for example, in somebody going through puberty where the breast tissue is rapidly proliferating as the breasts grow, that's when the breast tissue is particularly vulnerable to exposures. Any link, for example, between breast cancer and cigarette smoking appears to be in people who smoke at that very young age, when the breast tissue is dividing. Other times that the breast tissue divides, or doesn't really divide, but there's more activity, is when somebody's pregnant or lactating. And so not being exposed to chemicals during that time would make sense, though we really have no studies saying you need to avoid particular compounds during pregnancy and lactation, other than things you don't want to pass on to the nursing infant or to the developing fetus. So we have some studies indicating a signal between hair dye and breast cancer development, but most of the studies and the aggregated data together indicate that there is not a link. In terms of recurrence of breast cancer, it's often the case that the same things that increase the risk of breast cancer increase the risk of recurrence, but that's not the case for some things like, for example, alcohol, which we know is associated with a slight increase in the risk of breast cancer. A recent study showed that drinking alcohol doesn't increase the risk of recurrence. This is just one study. But the same would be for hair dye. Even if there's a signal in some studies that there's a relationship, the majority don't. And then in terms of recurrence, we have no data to suggest that there's a link between using hair dye after a diagnosis of breast cancer and recurrence. I hope this is helpful and reassuring. Drop a comment or a question below. We try to get back to you within a week or two. Let us know your experience, or if you have any other questions, follow us on Instagram. And again, don't forget to subscribe. Thanks for watching.